Hello there, Dr. John Nichols with Piedmont Reproductive Endocrinology Group. I'm the medical director and founder of the practice, and today I want to talk about PCOS, or what people call polycystic ovarian syndrome. And this is an important topic since PCOS Awareness Month is now happening. So polycystic ovarian syndrome, unfortunately, is not a very good name for the syndrome, but really what it amounts to is what we call an ovulation disorder. Now, it comes with lots of different other things involved with it. The diagnosis is made usually by three different criteria. One is patient having very irregular cycles. So a normal woman's having a cycle every month, hopefully ovulating every month. Patients with PCOS can have very irregular cycles. Every other month, 2 or 3 months, can sometimes go up to a year without a cycle. Of course, if a patient's not having a cycle, they're not ovulating, and hence that's some of the problems and difficulties we get into patients with PCOS getting pregnant, because they're not ovulating well. So that's one of the criteria, irregular cycles. The second one would be laboratory evidence of PCOS. And what does that mean? Well, the most common problem we see with these patients is that they tend to have elevated male hormone levels, such as testosterone and DHEAS, which is another mild male hormone level. So we can measure those levels. They can have, we call laboratory evidence of this. And then the third criteria is an ultrasound, which shows what we call polycystic ovaries. Now, poly means many. They're not really cysts, they're really follicles on the ovaries. So when you look at a patient who has PCOS type ovaries, they'll have kind of enlarged ovaries with multiple small little follicles on it, many little follicles. That's where the name sort of comes from, polycystic. And if you, out of those criteria, you only need 2 out of the 3 to get the diagnosis. So this is a very common thing that we look at for patients who come in with irregular cycles. And we look at these type of criteria to make the diagnosis. The other thing with PCOS, it can also come in sort of a spectrum. You can have mild PCOS, moderate to severe. Patients who have very severe PCOS can go a year without a period. They can have very high male hormone levels, can have a lot of facial hair, a lot of acne, a lot of what we call androgen excess. So there's different types of variation of PCOS. The other thing it's tied to also is weight. As far as obesity, as weight goes up, PCOS tends to get worse. As your weight goes down, it actually can get better. And this is also tied into another condition called insulin resistance. So some of these patients have a high probability of developing diabetes, which has to do with insulin resistance and sugar intake and these sort of things. So these are common things we talk to patients about in order to help them manage their PCOS. A lot of these patients, weight loss will have a dramatic effect on their chances for pregnancy and actually start ovulating on their own. But a lot of these patients are going to require treatments such as fertility drugs to kind of sort of force the ovulation. And that's what we use a lot for patients with PCOS. The other medication we use a lot with our PCOS patients is metformin, which is actually a diabetic medication. But remember, we talked about insulin resistance. That's another drug we like to use to help lower that insulin level and also help these patients start responding better, and more importantly, can also help them lose weight. So this gives you a little overview about polycystic ovarian syndrome. Thank you.